Hello everyone, this is Dr. Humanist again. Let us now study a very interesting topic, that is biosensors, which are very commonly used nowadays, right? Even if you take the smart watches, wristbands and all, these are nothing but biosensors only. So we are today we'll discuss about biosensors used in hypertension. What is a biosensor? It will have typically three things, right? Bios receptors, which will uh, monitor the biological element like enzymes, antibodies, nucleic acid. Then transducer, it will convert this biological information into measurable signal, and signal processor, so it will analyze this information, display the output in a user friendly format. Okay, so we are doing is we are taking the biological response and converting into electrical signal. Okay, this is what biosensors will do. Now we'll see in the hypertension cases. First one is variable blood pressure monitors. As I said, for example, smart watches are there, wristbands are there. Okay, so it is helpful in continuous blood pressure monitoring, right? So they are non-invasive devices, can track the blood pressures, and most of them will use pulse wave velocity. Okay, so this wristbands or smartwatches, the technology or piezoelectrical sensors. Other devices can use photoplethysmography or ECG, electrocardiography, to estimate the blood pressure. What they do is they are indirectly measuring the pulse waves and heart rate and then giving an estimate of blood pressure. Okay, they are very much useful in continuous blood pressure monitoring. Next is electrochemical biosensors for the biosensor for the biomarkers. What are the biomarkers can be used? Sample from blood, sweat, saliva we can use. So what are the markers? Renin, angiotensin, aldosterone, which are increased in hypertension. We know, right? Then nitric oxide, it's a vasodilator. So dysregulation of nitric oxide will contribute to hypertension. Sodium and potassium ions. Even the electrolytes imbalance will cause the hypertension. So that can be one of the biomarker for hypertension, right? So other technologies like optical biosensors are nothing but the bands or watches. What it will use? It is use the light based technologies like fluorescence light or surface plasmon resonance to detect the molecular interactions. So in the context of hypertension, we see in blood pressure monitoring like photoplethysmography, which detects the changes in blood volume and pulse waveforms, right? And biomarker detection also we can do, like oxidative stress markers in body fluids. These are optical biosensors. Next is implantable biosensors, like directly into your artery intravascular pressure sensors. These are also same. It works on the same principle. And the next is nerve sensors to see the sympathetic activity, right? Because even that contributes to the hypertension. So these are the some of the examples